Hey everyone, happy Saturday. Welcome back to the live stream. I'm excited to be here today. An exciting morning. I just finished up doing a live CRC review class for my local AAPC chapter. I did it to donate the money to the Hardship Scholarship Fund, which I am very near and dear to my heart. The Hardship Scholarship Fund was started a few years ago when I believe Hurricane Katrina happened. And it's to help support members who are having financial problems and maybe they need some assistance in getting their membership renewed or in buying books. So I was really excited to be able to give back in that way. Mania is not happening for the second year in a row, and last year they wanted to have a lot of donations and volunteerism, and it was just a little too much for me at the time. So it was good to this year be able to do something to donate back to Mania. So I'm excited to be here with you guys today. Definitely say hi in the comments, and let's get started with the stream. So I started out last week doing medical coding news, and there's not a ton of news this week, but I do have a couple of interesting things that I want to just kind of pick up and discuss. So I did find an article that was published recently. Let's see if I can find where this came from. But it talked just about value-based care programs and why PCPs should focus on coding and documentation in value-based care. And it was kind of a lot of the stuff that we've heard in the past, that there's a lot more focus now on diagnosis coding and not just strictly the fee-for-service model, where in fee-for-service, a provider does a service, they do, laparoscopic cholecystectomy, they get X amount of dollars. Now we're starting to see providers' fees are shifting based off of hitting certain quality metrics. And part of what plays into that is things like their diagnosis coding. So we're seeing patients that are, have very severe diagnoses. We know they're going to cost a lot. We want to do all kinds of things to keep their cost of care down and keep them healthy. Those are the big targets right now. And if you can just let me know in the comments if my video is syncing up. I wanted to try something new today, and I didn't have a chance to, but I'm thinking if it starts getting obscene where my words are not matching up to what is going into the microphone, I can switch cameras, and that might fix it. Might, just a little bit. So this particular article talks about how accurate risk adjustment ensures that payers with sicker patients and multiple chronic conditions receive higher capitated premium payments, which is true. But then the interesting thing I saw in this article is it says, and I quote, "Some PCPs employ medical coders, but few possess the highly specialized skill needed to code appropriate specificity required for value-based care." So essentially, what this is saying is that this article is saying, F you coders, you are not experienced enough to apparently code appropriately, and then totes about how fantastic computer-assisted diagnostic coding technology is and that they need clinical support to take the guesswork out of coding. So while I don't agree with maybe the way that they worded coders in here, saying, hey, medical coders, few of them possess the highly specialized skills needed to code appropriately. I wanted to touch on this because it did mention the need for computer-assisted coding. And I had someone that came onto the stream before it started and said, hey, is machine learning and artificial intelligence going to take your jobs in the future? And this is something I've touched on quite a bit, and really no. Computer-assisted coding, artificial intelligence, electronic assistance in coding has existed for as long as I've been in medical coding, which has been since 2007? 2007? It's been 13 years, something like that. So anyway, we've had these tools for forever. And the tools that we use in medical coding for artificial intelligence and assistance in selecting the right codes, I relate it a lot to things like computerized accounting. So there are smaller businesses, people that maybe have side businesses, that they can go on QuickBooks and they can handle their accounting through those applications pretty easily on their own. But people in larger organizations, people that like me that have a growing business now, need an accountant. And my accountant still uses QuickBooks. She still has everything that flows in from my various bank accounts into a QuickBooks account. But I rely on her to have that strict understanding of the accounting rules, the monetary guidelines, everything that's associated with that, so that she can advise me and make the most out of what I'm doing, make sure that I'm paying the least amount of taxes that I possibly have to, that I make the best advantage of all of the benefits that are out there, and I pay her a lot to do that. And that's what I equate coding to, that even though there are processes out there and things that make it easier, that they will never be able to replace a coder, the same way that no matter how good of accounting software we get, we will still need accountants. And that thought that AI is going to take over our jobs, that could be literally any position you could think of. I mean, my UPS guy, we could say, oh, well, soon we'll have drones that, are to be able to deliver packages, and we'll just program them, so we won't need FedEx, so don't get into FedEx delivery because it's going to be gone in a few years. You could say that just about any industry right now. So it seems like there's a hubbub going on in the chat because Melissa Miller passed her CRC exam. Congratulations to you, Melissa Miller. That is so fantastic. I am so happy for you. Congratulations. Absolutely congratulations. That is so cool. That's absolutely so cool. Quick question. Do I have a course on COC and CIC? Also, I bought your training for CRC. Yeah. So let me just use this quick to do a plug. If you're not familiar, I have 3 courses for CRCs, depending on the needs of whoever you are. So I have a full CRC course, head to toe, soup to nuts, everything you need to know for CRC. And then I have boot camps. My next boot camp is June 5th and 6th, and that's for if you already know the basics of ICD10CM and MedTerm, and you know the difference between a Medicare plan versus a Medicare Advantage and a Medicaid. You can take that, and it's accelerated, and it's just over 2 half days, and that will prepare you for the CRC exam. It includes the ebook and all kinds of stuff. And then I have, if you did self-study somewhere else, maybe you just bought a study guide, but you want a quick refresher and you want a practice exam, I have a smaller bundle for that. So I have all kinds of cool CRC prep material. Right now, I do not have COCs. I do have my COC certification. It might be something down the line I might do. And as far as CICs, I don't even have that credential yet. Let me tell you guys this, because this is funny and this is pertinent. I've never done inpatient coding before. I don't know how to PCS code because I've only worked in Profi coding and risk adjustment. So I've never done PCS. I could not calculate an MSDRG if my life depended on it, but I bought my first PCS book just recently. This is why there's a giant stack of books back here, because I'm doing some book recommendations. And I thought, well, you know what? I get questions about PCS, so I would love to just know about this. Like, step 1 is to at least get the book, right? And kind of figure out at least what this is all about. So I got my first PCS book, and I posted it on my Instagram stories. I was shocked when I opened this up because it is so different from CM. I had no idea. Like, if you look at, and I'll show this on the dot camera. If you look at, so here's our ICD10CM alphabetic index, and PCS alphabetic index, I think, is it in the back here? For this Bucks edition. This is the PCS alphabetic index. And then I guess to find the additional extensions, you need to flip over here, and then there's additional characters based off of body part and approach and device and qualifiers. So this is pretty foreign to me. Like, I get the gist of it now that I kind of looked at it a little bit. So it's something I'm planning on figuring out at some point, whether or not I want to do certifications for it. We'll kind of see. We will see. It's something that I'm looking into. It's on the radar. I am interested in getting an AHIMA certification, if for no other reason than to kind of get familiar with AHIMA and their processes so they can advise further. Because I only just realized recently how much more stringent they are than the AAPC about things like notes and which exact books you're allowed to take. Like, my ICD10CM version, I love for the CPC exam. It's the AAPC version. And I think what they do, oh gosh, I'm glitching out here. I think, let me switch my camera over. There we go. We'll have to see how this goes because it looks like I'm stretched out now. Whoa! But the other thing, I don't know why the heck my camera started acting all crazy there. Show advanced options. Let's change my standard definition. There we go. High def. All right, there we go. So my AAPC, my version of the ICD10CM book is not permitted for any of the human exams because it's the AAPC version. I didn't realize that they were so incredibly strict about their particular versions that you're allowed to utilize. So there's some differences there. Now, the other thing to consider, I am glitching today. Do you guys see me? Did you guys see that on your end? This little flickering that's going on with my camera? That is upsetting me. Oh gosh. Hold on one second. We're gonna be right back because this is just, I don't know what the heck's going on. It probably is my boyfriend woke up and started using the internet and now messed everything up. Let's see if I can get this going. I have a couple other cameras I can use here, so let's just see. No. Okay, so I'm back. I don't know what the heck is going on with this. But yeah, so there we go. Okay, show advanced options. I don't know what the heck is going on with this high def. There we go. So yeah, so the HEMA certifications are a little bit more strict, it seems like, than some of the AAPC certifications. So it'll be better to have a good experience so I can better advise people when they're saying like, oh, hey, I'm going for the CCSP versus the CPC. I can speak a little bit more to what the experience at the exam centers and so forth as well, what it's like. So yeah, I think I fixed the flicker now. It looks like it's much better. All right. I might not get all my bells and whistles though today, so I apologize for that. Let's see. Where are we? Melissa's saying, for the CRC practicing review, there was a quiz to take for 3 EUs and I passed. How do you submit this to AAPCs for credit? Oh, so this is a great question. So with any of the credentials, let me just back up 1 second. So as far as submitting CEUs, there are CEU trackers that you have on your AAPC account. Let me go and show you mine, but I just want to kind of show an abridged version of it because I don't want you to look at my member ID number and stuff. So let me scroll down past that. Okay. So this doesn't show my numbers. Okay, good. So let me share my screen over here. Screen 1, share. Okay, so on this screen, this is your CEU tracker. So what you would do is if you go to an AAPC event, oftentimes these local chapter events, they will automatically add them in for you. If you have a CEU number though, you just hit this add CEUs. Oh gosh, there's my member ID, which I did in the show. Okay, so you type in your CEU number here and then the date that you completed it. And then you can upload your document here. So whatever file you have, usually it's a PDF. If you take a screenshot with your phone, you can do that too. And you can add that into your CEU tracker and save it. There's also ways that if you don't have the index number, so if you have something that maybe was like a CME, because you can get credit for things like CME programs that you take through the hospital that maybe they're for providers, but you go and sit and get that education too. You can use that, or if you have other things where maybe you don't have the exact CEU number. But most of them you're going to have an index number for, so you can input them that way and save it, and it'll go into your CEU tracker. So for the specific ones that I have, what you can do is I get a CEU certificate, and then you can go into Adobe Acrobat and fill it in with your name and the date that you completed it, because it'll only release after you've submitted that quiz. And then you can put in the number in your tracker, save that file, and submit it into your CEU tracker. So that's where you get it. Bum, bum, bum. Yeah, so the CRC practice exam that I have, it's part of the review class that I have. It's on my website. I can bring that up and show it to you guys too. And then it has 3 CEUs, and there is a practice exam, so it's really cool. I'm so now that I had to switch my cameras, it is acting a little bit different for me now. Okay, here we go. So here are all the courses that I have right now. Risk adjustment coding course, CRC bootcamp, and then there is the practice exam and review. So the review is maybe like 3 hours long. It has a practice exam at the end of it. There's also an exam that you need to take for CEUs, and that's $29.99. So it's really cool if you want to go for your CRC and you want to like self-study and you're just like, I just want to take some practice exams and make sure that I'm doing everything appropriately. Then you can go ahead and do it that way. You can take the course that I have that's just the review and the practice exam. And it's pretty helpful, pretty handy. Let me guys know if my audio video seems better like this, because if it is and everything's syncing up better, I might just have to use the direct platform versus having to feed it in through my kind of third-party camera where I get all my bells and whistles. I'll have to just, I can do it. I just have to get creative with stuff. So yeah, that is, I love the review and practice exam, but you know, I've had so many students passing lately. It's unreal, and it's really, really happy to see so many emails and messages on LinkedIn of people that have taken the boot camp and taken the course. I'm going to tell you my two favorite things, I think, that I see as a YouTuber are when people pass their exams. They're like, hey, I passed my exam because you helped me out with your course or you helped me out with your video. The second thing that I love is when people tell me they came on to me because their instructor was showing my videos in their class. And I actually have a video that I've planned that it just came to me one day, and it's a video that I'm planning. It's not going to come out this week, probably next, because I have to slide plan for it. It's going to be one of more of my, I'll say, game videos. And this is great because I can actually use some feedback from you guys. I want to do, it's a themed kind of game. Let me know in the chat if you think it would be better if you like it when I'm just like, let's code this, and you just code the whole thing out. Or if I'm like, let's find the code for this. Is it A, B, C, or D for coding games? Let me know if you want the multiple choice option, or if you'd rather I just say, find the code for this, and then you pause the video and you look it up and see if you got what I got. But I have one that I'm planning. It's going to be one of those great videos that I think, like, when instructors are having a bad day or a headache or a hangover or whatever, they're just going to be like, I can't do it today, so we're just going to watch this video that Victoria made, and we're going to play this cool coding game video that she made. And I think it's just really going to be a hit, and it involves costumes. I got a costume that I'm going to be wearing for it. It's going to be super hyper animated. I'm really excited to put it together. But yeah, I think, yeah. So one of the ideas I had as far as multiple choice is I wonder if I should almost put it together like a Who Wants to Be a Millionaire type of thing, and do kind of format it that way, because I have seen some kind of like cool tools where you can kind of make it look like the Who Wants to Be a Millionaire, you know. And I think even that, with the multiple choice, I could probably make some like funny different answers for things, and maybe even some like med-term and anatomy type stuff I could fit in there. So yeah, that's definitely, look out for that. I'm gonna have to really hype it up because I'm gonna put a ton of effort into this video. Oh, Dawn is asking how much the boot camp is. I think the early bird special just ended for it. So right now the boot camp is currently, I'm still working with these layouts. How do I do this? Ooh, there I am. The boot camp is currently $399, and that includes an ebook study guide and practice tests. And then you get access to the recordings as well. So all the recordings then go into the boot camp. And yes, it's Saturday, Sunday, and then it's 2 half days, Saturday, Sunday. I know, and you know what? That is a great thing about the fun videos is I'd also like to maybe make some things that are available for chapters too. Like I put it all together and it's on YouTube, but also like, hey, if you're a chapter officer and you want to dress up and do funny games too, like here's the slides. See, that's the other thing I was thinking too. So will the game run during day or night? I was going to post it just as a video, but I could also do it live and maybe have prizes. But I'm just afraid that I would do it live and it wouldn't be as good. Because I don't know. It's kind of a toss-up. Like, do I make the super edited, high definition, awesome looking video, or do we do it live and maybe we can have prizes and stuff? So I'm leaning more towards doing the edited version, but I think doing like some live streams where we play games and give out prizes would also be cool as well. What are my thoughts on ICD-11 that's in question for 1/1/2022, not happening in the US anytime soon? So if you go onto the WHO website, I just wrote this down because I was on a webinar that they did the other day, at least partially. I don't remember what the heck was going on, but I was trying to accomplish something else during the day. I think my kid's teacher was out and she had independent work that she needed to do while I was trying to get this all done, classifications. So let's see if I can get this up. No, okay. I probably spelled it wrong. Okay, you know what the other thing is though? They have a Facebook page for ICD-11 and I liked it the other day. Where is it? Is this it? This might be it. For those, yes. So they did just host some sessions about ICD-11. Imaginary dreams, please stop spamming my chat. I don't know. I can do plenty of reports on inpatient E&Ms. Just please stop spamming my videos. That's not okay. And I probably have some, to be honest with you. So this is their Facebook page, and they will post stuff here about ICD-11. And I just watched a webinar that they had on ICD-11. So ICD-11 is coming, but it is not coming in the US anytime soon. So while it is going to go in effect and you can use it on January 1st, the US will likely not adopt it for, my guess would be earliest 5 years. I'm thinking probably more so 15, 20. So you can get lots of information about ICD-11 from the World Health Organization. They have a Facebook page, so it is very digital. It will likely not be printed in books, but you know, as slow as we are to adapt things in the United States, I can't even tell you how much time it took to just to get the ICD-9 to ICD-10 transition done. I think the transition to ICD-11 is going to take a while. So even though it's there, it's accessible, it can be used. I don't think the US is going to be using it for several years. So I wouldn't worry too much right now about ICD-11. Let me see if I can find the other site that I wrote down here. WHO INT classifications. Yeah, so this is the website that they have on the World Health Organization about ICD-11. So you can find out more information here. There's an introduction to ICD-11 webinar. Let's see what that is. Introduction to ICD-11, yeah. So it looks like this might be the old one. Overview of ICD-11. So you can, yeah, so they have some presentations that you can check out here with the slides of all the stuff about ICD-11. But again, it's just the way that we would have to train everyone, update systems, you know, EMRs, payer policies, you know, everything that's going to take several years. So I think I would expect at least 5 years until we're even looking at ICD-11. Melissa Miller says if you need 5 more CEUs, let me tell you, this is really cool coming up. And if you have an account with Novitas, So that's my Medicare administrative contractor. They have their symposium coming up next week. I think it is Wednesday, Thursday, Friday, that they're giving out a bunch of CEUs every day, and I signed up for a whole bunch of stuff. Let me see if I can find it. But you have to have an account. And don't forget, for those of you that are AAPC certified, you can get CEUs by visiting other chapters as long as they have space for you. So let's see here. Novitas Education and Training. And there is their Part A and B calendar. So they have a big old symposium coming up in the next couple of days where they're going to go over all kinds of stuff. And you can see here that each day there is 4.5 CEUs available. Excuse me. So even if that's not your MAC, you can still go and listen in and get some of those CEUs. Bye, Melissa Miller. I'm going to stand up here for a second because it's getting fidgety. Anna's saying, I am currently enrolled in AAPC and I'm looking for extra practice for coding any tiles. So one thing you can do is practicode. I'm hearing different information about whether or not you can start practicode while you're still doing your medical coding. So that's definitely practice you can do. And even if you can't start the practicode to remove your apprentice removal, there are specialty modules you can take. The other thing you can do, and this is where I get some of my stuff from. Now, if you're just looking for strict practice, like I just want to practice my coding, this might not be as good as if you're also looking for the answers. But there's this really cool website, and it's called mtsamples.com. And this is where I use when I'm looking for samples. And sometimes I'll just take them and modify them, or I'll just say, hey, this is where I got it from, because they said it's cool if you use that. Just feel free to print, share, like, and distribute. Our requirement is that while linking and sharing, please notify us and give us credit, which I did. I notified them and I give them credit. So this is basically medical transcription sample notes. So if you just want to get familiar looking at notes and how to code them out, I mean, there's like a couple thousand of them. So oftentimes I use them, like if I want a soap note or something, or like this gentleman that's in here who very, very badly needs inpatient note coding samples, I can do that for you. I just need sources to take them off of, because I can't just go into, the step-by-step medical coding book and be like, hey, copyrighted information. I'm just going to monetize you on my channel. So I can go in here, I can pull out some different notes. Let's see if we have something in here. Inpatient, I don't know what they want to classify it as. Soap notes, progress notes, it might be under there. Stay connected, clues, no. So I might just be able to go on here, pick out some notes, maybe modify a couple of things, change some things. And that's what I use for when I kind of do my coding cases, is I use mtsamples.com. So you can go on here and just be like, I'm just going to take this note and try and code it out and practice it, practice coding the diagnoses and see what the service is. But they're not going to give you they're not going to give you the answers, because that's not really what this site is. It's not like a medical coding practice site. It's literally just documentation. So it's great for using for just getting familiar with documentation, but it's not going to give you the answers. If you want practice, the other thing you can consider is if you're using this in your school or not. There is, I'm hitting the wrong buttons now here because I'm using a different camera. The other thing to consider is the step-by-step books. So if you're not using these in your class, like if you're just taking classes with the AAPC, these are great, the step-by-step medical coding books by Bucks. And these have the odd number answers in the back. They don't have all of them. I actually emailed them the other day because I've been recommending this to people, and a couple people have been like, I'm frustrated because like half the answers aren't there. So I emailed them to see, like, if someone's a self-study student and they buy your books, like how do they get the rest of the answers without an instructor? So more to come on that. But yeah, those are great. The book itself, step-by-step medical coding, these do have all the practice questions that they have in there. The answers are in there. The other thing you can do is, I think there might be a couple other practice books on Amazon. I'm not sure. I'll have to take a look. Oh, these I found on Amazon. I think they might be in the video description on YouTube. I think I keep them in there, the step-by-step medical coding books. I'm doing a whole book recommendation video. That's why I got the stacks back here. Do I know of any coding jobs that you can work just on weekends or part-time? Yeah. So right now in risk adjustment, they're hiring a lot of people and they include part-time positions. I think most of the part-time positions I've seen recently have required at least a commitment of 20 hours a week. So that's one of the things. So it might not be as short as working Saturday, Sunday, but there are part-time positions out there. Let me get over here. Where is my codersdirect.com? I had them open, but then I got all excited showing you guys about ICD-11. So let's see here. Codersdirect.com. So this is codersdirect.com, and they have lots of positions on here just for medical coders, and you can filter by, if you're looking for example for remote, you can filter by if they'll accept CPCAs and search that way, and it'll tell. I'm pointing to the screen like you can see me pointing at it. You can see on the right-hand column here, it will tell you if it's full-time or part-time positions. Now the search tools are a little bit more laggy, so it does take a while to load, but even just to, that's probably not going to load too fast either, but you can see if it was a part-time position, it would show here part-time on that section of it. By the way, speaking of Amazon, I forgot to tell you guys this. I self-published a book. It is not probably what the ultimate book that I'm working on, which is what I'm doing. But this is a notes book. So it's just a cute little book I made that is literally just filled with lined paper, but it's cute and it says medical coding notes on it. So if you're interested, you can get this. You can get this on Amazon. I bought a couple of copies for myself, and it's just somewhere to write down your medical coding notes, and you're going to know it's the medical coding notes because it's got that cute little cover on there that says medical coding notes. Because I have a tendency, I don't know about anyone else, I just buy blank books and then my kid takes them, and I have any idea where they ever get to. They're lost forever in the dumpster that is her bedroom. But I am planning on eventually, sitting here trying to press the wrong buttons. I am planning on eventually writing a book. I did start one back in November. And because there's a National Novel Writing Month is November, and the book I was writing, it was November, it was right before the 2021 E&M changes, and I was doing so much provider education and helping out with that the book writing did not happen in the month of November. So I don't know if I'm going to try again this November or just kind of pick away at it. We'll have to see. But yeah, Dawn, if you go on codersdirect.com, there are definitely options on there, and a lot of stuff right now for risk adjustment, and they are taking apprentice coders too as well. I can't read your screen. What was the website again? Crystal, you'll have to clarify for me. I don't know which website you were talking about. Were you talking about Coders Direct? Is that the website? Is it this one? Codersdirect.com? Because that's where all the jobs are. That's the coding job I was talking about. Codersdirect.com. By Mark and Rich. They're great. Oh, another thing to mention is if you do also need CEUs, because I know we were talking about that a little bit, there are a couple of resources now. So HitKnots has gone down. So don't go to the HitKnots website because I think it got attacked and there's malware and kind of stuff on there. Brian Quee took it over. So if you go to Medical Coding Geek blog, he's been posting CEUs there. There's also medicalcodingceus.com, and there is free or cheap CEUs for AAPC, which is another Facebook group that you can go to that they list free and cheap CEUs. Hey, Lee, I've seen you here before. Do you offer online one-on-one versus one tutor? I have 30 questions. Most of them are general questions. I do offer tutoring services, but they are at a very, very premium price. Just because of everything that's involved then with my years of experience, my speaking engagements. You can also get tutors if you just need a tutor and not specifically me to tutor you. You can go to tutors.com, you can go to Wyzant.com, and you can get medical coding tutors through those websites. So tutors.com and Wyzant.com, WYZANT. By the way, if you haven't already, make sure you hook me up with a thumbs up for the stream today. And also let me know if you are interested at all in me like having background music in the stream, because that is something I know a lot of streamers like to do, just have some like calming, low-key background music, and that is something I can hook up. Look, you can see my lamp in the background. Move that out of the way. Oh, it's still in there. So what is next? What is next on the list? So yeah, if you need tutors, there are tutoring services available. I feel like I should have someone that I have a good relationship with as far as to refer to for tutors. And I know one person did reach out to me, but I can't recall off the top of my head what that person was. Getting ready to enroll in a coding course. So glad I found your channel. I'm glad you found my channel too. Thank you for all of your info and great videos. Dawn is asking, is the CRC hard? I wouldn't say so, although it depends a little bit on your base knowledge. So if you already understand about ICD10CM, you know a little bit about Medicare Advantage plans, that is something that will make it easier for you. You know, one of the stumbling blocks that I think a lot of coders have is we've worked in, at least in professional coding, in this fee-for-service model for so long, where we're, you know, get the CPT codes out because that's what we're getting paid on. We're getting paid on CPT. Whatever diagnoses, we'll get that CPT code paid, put them on the claim. If they have them, get them out the door as fast as you can. And we've not paid as close attention to things like diagnosis coding. And now those are really coming into the forefront, right? Now we have so many quality measures and provider bonus payments that are funded based off of, we know these patients have these expensive diagnoses. They have congestive heart failure and cancer and COPD with exacerbations, and they have, you know, diabetes with complications, and we know that's going to cost a lot. But let's try and do the best we can to monitor that so that they don't exacerbate to the point that they get to the hospital, which is going to cost us more. And the forefront of that is really recognizing the ICD10CM codes and putting the right practices in place when we go, hey, this patient has diabetes, like we need to get certain protocols in place because we don't want them to develop a complication. We don't want them to develop diabetic gangrene or diabetic ulcers or problems with their eyesight. We want to make sure that they're seeing an eye doctor regularly and having those checks. So, you know, there are a lot of coders that have really struggled with the fact that they thought they kind of knew ICD10CM coding, and when they really went back and looked at the guidelines and reviewed some of these coding clinics, it's like, oh, well, I guess I didn't know it quite as well as maybe I did. Hey, Paula Neary! Good to see you here in the chat today. Don't forget to give me a thumbs up. Like, share with your friends. So yeah, the more familiar you are with ICD10CM coding and the guidelines, that's half the battle. Because 60 of the questions on the CRC exam are just going to be diagnosis coding. There's going to be a bunch of stuff too on risk adjustment models and protocols and documentation pitfalls, and then a little bit, there's like 8 questions on midterm, like 8. You could literally fail every question on midterm and still pass the exam. And then there's also a little bit maybe that they need for pharmacology, like if you want to match up like this medication meets the criteria for this diagnosis. Dun, 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 dun. Paula Neary had an interview with a chiropractor. That sounds great. I bet you get good perks with working with a chiropractor. I used to have to go to a chiropractor for a while, and that was it's a good feeling getting your back cracked, right? How do I feel Epic affects the needs for coders? So let me tell you, I've been through Epic in a couple of organizations. And the first organization that I was working with that migrated to Epic, there was a huge, huge fear with the coders. Oh, we're going to go on to Epic and administration's not going to need us anymore because the providers are all going to pick their own codes. And there was a lot of fear, but it wound up being that coders were still needed more than ever. You know, providers are not coders. Most providers don't want to be coders. They just want to see patients and they want to provide good care. And if we can get them to document the best, like that's my best world, like they just document appropriately. They're not just copying, pasting, using cookie cutter stuff from patient to patient to patient. So Epic is an electronic medical record practice management system. It does your documentation, it does your orders, it does everything. It is an enterprise system for healthcare. So a lot of times in Epic, providers will do things like pick their own diagnosis codes. One of the organizations where I supervised, all of our primary care physicians, they would, and a lot of the specialties too, in the office setting, if they wanted to bill a 99214, they would bill a 99214, they would bill their diagnoses, it would go out the door. But we focused our coding support more on the things that were higher risk, like if they were billing vaccines, if they were billing something with a 25 modifier, if they were billing a 99215, we would look at that. We would bill all their surgeries, surgical stuff, specialty stuff, still all got reviewed and coded. Some people don't like Epic. The people that don't like Epic should be forced to work on Cerner, because Cerner is, I shouldn't say anything because I don't want to get sued, on the off chance that someone from Cerner would watch this. But Epic, going from Epic onto a Cerner platform made me really, really appreciate Epic. Because when I was auditing in Epic, I could pull up a note. Here's my note. Here's the exact attached bill to it. Here's all the stuff that was billed. Here's the exact, 1500 form. Here's who made this documentation. Here's who started it. Here's who edited it. Who viewed it. Here's the entire audit trail. Everything I needed was right at my fingertips. Working on Cerner, I pulled up a note. I had to pull up an entirely different system then, independently, to get the 1500 form or the UB04, and I had to dig through a million different things to figure out which exact one was the one that matched up to this piece of documentation. So so there have been organizations that have gone on Epic and gone, we don't need our coders anymore and we're going to get rid of them, and then had to backpedal and had quite a lot of expenses due to that. So I think Epic does impact the need for coders, because sometimes it does actually make you need more coders, because oftentimes there's providers that think that when they search in Epic that it's like Google, and whatever that top result is, that's the thing that they should click, and whatever is on that top result for diagnoses is usually an unspecified code. So they'll pick E11.9 because they just want to get diabetes on there and send it out the door, but really that patient had diabetic nephropathy or diabetic retinopathy, and that impacts a lot of different things. Or, you have these providers, everything I do is a 99215. All of my patients are the most complicated and sickest patients there could possibly be. So everything gets billed out of 99215 and it just goes out the door in Epic. So there's a lot more coder intervention that's needed. I think, especially in some of these Epics, there's so much more better structuring that could be done with apprentice coders, looking at some of those minor little things and cleaning that up. That would help them build and really work in more apprentice and entry-level coding positions. So I think organizations really should look at their structuring and what can we have our apprentice coders do in these systems, look at these 25 modifiers and review them, or diagnoses or whatever, and get more entry-level people in. Can I please do a session on dental coding? I don't know dental coding. I don't know dental coding. I've never taken a dental coding course, and I don't have a dental coding book, but that's a great idea. That's probably something I should add to my stack, right? Like, I should get a dental coding book and kind of look at it so I can talk about that. That would be a cool video. Do you think that would be a cool video? Like, learn dental coding with me. Here I am, Victoria. I have no idea what I'm doing, but let's together, you and me, we're going to learn some dental coding. But yeah, Epic can vary a lot between healthcare systems. I think the way that you have it programmed really is everything. And not just the way you have it programmed, but the understanding of the people working in it and knowing the different things you can do with Epic, how to program it, and really talking to those, having the people in place that can work with your Epic representatives to build it the way that is best for your organization. Jessica says, I've been a remote coder for 7 years. I'm not certified yet, but studying to take the exam online. I took it 7 years ago and failed 3 times at 69%. Any advice? I've been through school. So practice exams are crucial right now. If you don't have something like the step-by-step workbook where you can kind of work through some cases. That might be helpful. Just maybe even going back, because you're obviously not going to need a full course again, but maybe going through some of these step-by-step. I have a video on self-studying medical coding that has some resources that might be helpful. And at the very, very minimum, I would say, though, get a review class. You can get those through your local chapters. I have one online that you can take that comes with the practice exam. So review and practice exam, those are the key things. And practice exams, aim for 80%, because if you get 80% on a practice exam, you're at a much better place, a much higher chance that you will be able to pass the CPC exam if you're getting 80% on the practice exam. And just to show you, because I do have it on, while I'm here and I've got my website up, I do have the, because I'm not teaching full CPC yet. That's going to take me a while because I'm still kind of getting it together, and there's still just other considerations with some of my affiliate arrangements. But, so on courses, there is CPC review and practice exam that I have available. There's 8 CEUs if you're already certified, and it is $29.99. It's about 8 hours worth of video, and there's a quiz that you have to take then if you want the CEUs, and then there is a practice exam that is part of that as well. Crystal, what is the best way to learn coding conventions? My class skimmed over them and focused on just finding code. So if you're talking about coding conventions like the coding guidelines and conventions, there are a couple of videos that I have on the channel, and actually this might be a good thing for you to just go for. I have a whole playlist for ICD10CM coding that goes through how to look up a code and then just talks about the guidelines. And a lot of it, I'm going to be completely 100% honest with you, a lot of it is just me reading it. So people will point that out eventually. They'll be like, this isn't really helpful, you're just reading it. A lot of it is me reading it or kind of talking through it a little bit. And then occasionally giving some examples as I get through them. But yeah, so ICD10CM medical coding guidelines, there's an entire playlist that you can go through for that. As far as CPT, I've got messing myself all up. As far as CPT, there is a series that I've started doing on that as well for CPC review, and I'm going by kind of chapter. Look at how cute I'm getting with these thumbnails. I'm so proud. I'm just gonna pat myself on the back here for a second. I am like so dumb proud of this thumbnail right here where I'm blowing on a dandelion because I'm talking about the respiratory system. I was almost afraid I wasn't going to be able to do this because it rained and all the dandelions were wet on the day I wanted to take this picture, and my backup was going to be like blowing a bubble or something, but I'm really proud of the way this thumbnail turned out. But anyway, yeah, so these are where I'm going through. I go through different by chapter videos, and you can see there's only 3 videos now, but I'm adding to it. Next is cardiovascular. So that also goes through some of the, I don't want to say all of the CPT guidelines, but some important things, and then discusses like the code lookup, like how can you look up a code through the alphabetic index versus if you're just going right to the chapter. Do I have any tips for future RHIAs? I wish I did. You know, my best tip is to go and follow someone else who maybe has their RHIA. Brian Quee from Medical Coding Geek, I believe he has his RHIA. So check out his blog, his podcast, his YouTube channel, Medical Coding Geek. He has more information about RHIA stuff than I do. I'm trying to think who else I know that might have more RHIA-oriented type material. Can't think of anyone else off the top of my head. I used to be a nursing assistant before I had children, and now my kids are all going to school. Oh my gosh, I'm so envious. My kid's been going to virtual school for the past year, and it's been tough because first off, my daughter's on the autism spectrum. She's very high functioning, but she's very easily distracted. She's very clumsy. Her social skills are not great. And since day one, I've been told keep things consistent because that's what's going to be successful for her because of her autism is things are consistent. So I'm like, I'm going to keep her in virtual school so that things are constantly consistent, that we're not in this hybrid model where she's in, she's out. Now the data hit this point, now she's back in virtual. So I'm like, okay, we'll be in virtual. Now they're like, oh, well, they can go back full time. And I'm like, you really want me to pull her out of virtual school and have her go back to school full time, change her teacher when she's only got 2 months left? I'm like, but she's going to summer camp now in a couple of weeks, and I cannot wait, and I can't wait for her to go back to school because it's just nice to have that routine that I get up in the morning, I drop my kid off at school, and she's good, and I don't have to worry about her, and I can do my work for a few hours. So does being a CNA help the schooling? Absolutely. Absolutely it does. Point one, you're already familiar with MedTerm, right? Point two, if you've worked at a CNA, like you have already worked with probably some documentation, some medical records, at least a little bit probably, I'm sure about insurance, about, different, how to work with providers, right? So that's all important things that you can transfer over into medical coding. And even you probably know more about processes like how to document for an injection and stuff like that than I do. So there's a lot of components that will help out. Of course, the coding components, maybe not so much, but you'll be more familiar with some of these terms, right? And some of these disease processes. And that will definitely play over into a great medical coding career. Good question. Paula's saying she wants to learn dental coding with me. Yeah, I think right now I have to figure out this whole PCS thing because that's brand new to me. That is absolutely brand new to me. Hannah is saying, how do I get better at ICD-10 coding? It still confuses me. So one thing you can do is go on my channel because I have a whole section there about ICD10CM coding. So that's something you can do. The other thing is if you just read through your guidelines a couple of times. I mean, sometimes it's not exciting material. It's not animated or fun. But it is one of those things that as you read things, you become more familiar with it. And the more familiar you become with it, you pick up more things. So, I don't know off the top of my head all of the different guidelines about sepsis. I don't know all the different guidelines about sepsis. But I know there are guidelines about sepsis, and I know if I'm coding sepsis, I should probably go and take a look at those guidelines, and I know where to find them in the book. I really like the R of your background, very soothing purple hues. Yeah, so these are different color changing. You probably figured that out by now, but these change colors, so I can change them. And I like the purples too, but I can change them like, this one's blue right now. You just have a remote that just changes colors. If I was super fancy, and I could probably program this if I really wanted to, I could, oh, that one just changed. There we go. I could probably program them to like change different colors when I get a new subscriber. And if you haven't already, make sure you go to the YouTube channel and subscribe. But I haven't gotten that fancy yet to change it so that things flash and go highlighted and all kinds of stuff when I get subscribers and so forth. But I like the purple as well. Yeah, thank you. This is, I think, a little bit more messy than I usually keep my office because of all these books that I've been trying to work with right now. And I could stick them on my floor, but I don't think you guys are too concerned about the fact that a medical coder has books on their desk. Kieran, please advise me to pass my exams. So you are in luck because I have lots of videos to help you pass your exams. I'm assuming you're talking about the CPC exam because they could be any type of exam, right? We have lots of different certifications in medical coding and different types of coding. We have CRC, COC, CIC. CPRC, CER, alphabet soup. But there's lots of resources on the YouTube channel that I have here. Oh, here we go. And there's, like I said, the new series that I'm doing that's just almost chapter by chapter that matches up with the CPC review or the CPC courses. So you can kind of go and say, hey, I need help with musculoskeletal. And of course, it's not everything, all things. It's not that I put the entire course online, but just a couple of things to point out to review and questions and how we piece them together. And then what else have I got here? If you need help with E&Ms, I've got a whole E&M section. And apparently I need some inpatient cases there. And I have my ICD10CM whole section there, going through all the guidelines. Lots of cool stuff. I almost kicked myself out of my own stream there. Carol says PCS is fun and halfway through AA, PC, CIC course, and now I love it more than CPT. You know what? I think I will love it too, especially because like the AMA is so funny about their copyright with CPT. It's one of those things where I'm like, I don't know. I feel like ICD10CM and PCS are probably easier to work with because there's probably more things you can do and show and stuff without having to worry about the AMA getting upset about it. But yes, thank you. So this is my. I love this shirt. I love this shirt because first off, reading rainbow, but second, it's medical coding, right? Right? Like it's in the book. Take a look. It's in a book. ICD10CM. Amy says, I already have my CPC and CCS, and I'm getting ready to take my CPMA. How is the best way to study? How to prepare? Okay. My tips for the CPMA. So I'm going to first off tell you it's been a hot minute since I took the CPMA. I took the CPMA back when it was like first coming out, and I think the exam is probably harder now than when I first took it. But some of my tips for the CPMA exam. So first off, I love Deb Greider's book. I don't know if that's still good for it or not. Definitely get the study guide. The study guide for CPMA will help you out because that's going to highlight all the pertinent information. I actually took the Blitz course for the CPMA that CCO.us offers, and that was, oh no, I didn't take that. I took that for CRC. I had my friend take it for the CPMA, and she said that their Blitz program for the CPMA at CCO.us was really, really helpful. It's like that halfway in between a full course and a review. But one of the key things, and this tripped up some of my friends, is when you're preparing for the CPMA exam, and let me bring this up here. One of the things you don't want to miss out is, keep wanting to hit the other buttons. One of the things you don't want to miss out on is these other resources. So where is it? Exam breakdown, proof manuals, FAQs. No, that's not it. There's a section on here where it tells you about additional resources. Maybe it's under the prepare for exam. It's probably there. Additional preparation methods. You do not want to miss this because they want you to be familiar with these. So additional preparation methods, and then they have all of these different things that they want you to look at about ABNs, about CERT, about compliance, about the Joint Commission. These are definitely sources that you need to get familiar with because these are ones that you're going to want to get, they're going to have questions about them on the exam. So do not miss these additional preparation methods that they have here, because they will absolutely ask you questions on that. So we are getting close to 3 o'clock p.m. Eastern Standard Time, which is when I usually end the stream, but I see a couple of questions on here. Let me just make sure that I'm not missing anything. I want to be as helpful as I can with my time. Let's see. Evelyn, new subscriber here. I'm going to start the medical billing and coding course at my local community college. I'm a proud community college girl. Very, very proud community college girl. Transitioning from working with dental insurance claims. Any suggestions for studying? Wow. So maybe you should come on and teach us about dental coding, because apparently I do get that interest in dental coding every now and then. It's, yeah, something that apparently there's some interest in. So any suggestions for studying? Yeah, check out my YouTube channel. There's lots of resources I have on there. ICD10CM, we're going through different chapters. You're going through your community college. Hopefully they'll get you on these books, because these are the ones I used when I used to teach at my local technical school, and they're phenomenal. If not, if you need additional practice, you might at least want to get the workbook version of this, the step-by-step medical coding book. They're phenomenal. And I love them. And if you need additional assistance, I have review classes online. I have all kinds of cool stuff. But yeah, there's lots of resources, and there's way more YouTubers out there now than me. There's Medical Coding with Huang. He does a great job. People swear by his videos. Dr. Campbell's CDI Corner is out there. Let me think who else actually does like medical coding actual content. Oh, Stalking Horse LLC. I think she does some E&M stuff that you might want to check out. I think that got pretty popular. I have to get my hair cut, you guys. Tomorrow's haircut day. As I'm looking here in the camera, I'm like, it's definitely time for a haircut. What do you guys think? I think so too. It's 3 o'clock. I'm gonna be heading out. I'm going to the fabric store to get some stuff, this costume for this big medical coding fun video I'm gonna be doing. So it was great spending time with you guys. Thank you so much. Again, don't forget to give me a big thumbs up, like, share, subscribe, join channel membership so you can unlock all of those cool extra features that the channel members have. I will see you guys soon, and until then, you just keep on coding on.